good day, ma'am. For today's video, I am going to assess a catheterization. So first, I am going to assess the client. So ma'am, do you feel any pain po? Okay, next is I'm going to check a doctor's order. I'm going to determine if the procedure is straight or indwelling catheterization. So the catheterization that I'm going to use is a poly catheter. And I'm going to assess if the client is need to the collection of specimen. So, we don't need to collect a specimen. So, good day ma'am. My name is Rhea Banasagdinos from Mabini Colleges. And I am your student nurse for today. May I know your name, your birthday ma'am? Okay. So, for today ma'am, I am going to assess a catheterization. A catheterization is the insertion of catheter to the urethra into the bladder to drain urine or to instill medication or fluid. Is that okay with you, ma'am? So I will assess the client in appropriate position. I will position the client in a dorsal recumbent. Next, I'm going to wash my hands to prevent the contamination of microorganisms. And then the type of catheter that we are going to use is a poly catheter, and it has a 12 to 14 French. And we will assemble all the equipment needed, including a catheterization set, a light source, and a bath blanket. This will open the catheterization set. And then I'm going to set up the receptacle for soil cleaning swab. Next is we will open the drainage bag and we will attach it to the bed. And then I'm going to wear the gloves. And next, we will attach the syringe and the test balloon by stirring the sterile water and deflating, withdrawing the water. And next, I am going to connect the distal end of catheter to the drainage tubing. Next, I am going to clean the urinary medulla. And next, I am going to lubricate the distal portion of the catheter using the lubricating jelly. And next, I am going to insert the catheter gently in a rotating motion 2 to 3 inches because the patient is female. Now, can you take a deep breath when I insert the catheter? And then I am going to inflate the retention balloon with the sterile water. And then I am going to take the catheter on the tie of the heel. Then I will place the drainage bag below the level of the bladder. And then I will assist the patient in a comfortable position. Gather and discard the disposable equipment. And then I will wash my hands. The indwelling catheter must be drained properly and it must be inserted without discomfort. And the client must be comfortable. And for the documentation, I must document the date and time, the type and the size of the catheter, whether a specimen was obtained, the amount of urine, the description of urine, and the client response to the procedure. For today's video, I am going to assess the removal of the indwelling catheter. Next, I am going to wash my hands to prevent the contamination of the microorganisms. And then I am going to assemble all the equipment needed. So, good day ma'am. My name is Vanessa Delinos and I am from Luguni, Congress. And I am your student nurse for today. May I know your name and your birthday, ma'am? Okay. So for today, ma'am, I am going to assess the removal of indwelling catheter. So this is the change of the indwelling catheter. I will place the protective pads under the patient hands. I will enter urine into tubing into catheter bag. give a report. And then I will gently pull out the catheter, and then I will ask the client to take a deep breath. Ma'am, can you take a deep breath as I pull the catheter out? And next, I will cleanse the perineal area of the client. And then for the evaluation, I must evaluate the amount and the characteristics of the output. And then I will evaluate if the client resumes a swell voiding pattern. And for the documentation, I will record the amount and then the characteristics of output. And then I will record if the client resumes usual voiding pattern.